For those of you who attended the program last year, I talked a bit about issues with COVID and diving. And so we're going to look at a more optimistic view of things, which is the return to diving in a post-COVID world. And so as things are getting better and we're seeing more and more um, of the COVID cases dropping, what does that mean in terms of us going back and getting back into diving safely? So we want to try to make your return to diving as safe as possible. So I want to talk about three areas. What is fitness to dive? And then if you did have COVID and you were recovered, are there issues that you need to be concerned about? And then finally, vaccinations. So in terms of your fitness to dive, if you're like me, you really didn't get as much exercise as you normally would over the last year. There's a lot of stress, a lot of not really knowing what's going on from day to day. And so there are a lot of things that can impact you, not only just your physical state, but your mental state. And so some of those things are inactivity. People who would do normal laps in swimming pool probably weren't able to get to the pools to do that. There's COVID burnout, just malaise of when's this going to end? When's this going to end? What are we doing? Why are those idiots going out in mass without masks and causing these big spikes in cases? Just sort of this burnout. A lot of this leads to stress eating. And there's actually something that's been tagged as quarantine 19, which is the additional 19 pounds of weight gain you've gotten over the last year on average. The study done by, oh, come on, blanking on it, Minnesota or Missouri State or Missouri University, it showed that people were gaining about 1.5 pounds per month on average. And as the graphic shows, more were snacking more, as to be understood, could be understood, more were cooking at home, but were they cooking things that were healthy? Exercise was down, weight gain was up. And so people were dealing with sort of what I call a Tiger King syndrome. It's like, what do? You're going to sit down and you're just going to binge on various programs, or what I call binge bout or blout. Just because you're sitting there eating and binging food, you gain weight and you lose your conditioning. So there are a lot of programs out there that are talking about things to do to get back to diving safely. One of the big ones is Dan. Dan has an actual return to diving safely guide that you can pull off their website. And their primary focus is on you reviewing your health status, refreshing your diving skills, definitely looking at your equipment. If you haven't used it for the last year, you need to have it looked at. You have to get it serviced. Reviewing your travel plans. What do you need to do to take into account some of the restrictions, some of the policies and protocols that are in place still in the world in this post-pandemic environment? The other thing is, how are you doing? How are you doing today? All this stress, all this angst, all the anxiety of this last year has the potential of causing the same sort of symptoms as post-traumatic stress disorder. And so even though you may seem to be okay, and I've noticed this in me, that I tend to be a little bit more jerky and responsive if I hear a loud noise. And that's one of the indications that there's some stress disorder there. And you just have to work at becoming more relaxed and calming your system down. And some of that can be done by breath control. There are plenty of different breath control programs out there. The one I list here is Breathology, because they have on their website a free ebook and a video course to help you start this breathing, to get your breathing under control and be able to relax more. And then in terms of relaxing, yoga and meditation are good. And there are plenty of online places where you can go listen to meditation tapes. There's some yoga classes that you can pull up, but take advantage of them. One of the things everybody has learned over the last year is what you can find online. There's a lot of information out there. You just have to, when you pull it up, make sure it's from a reputable source and that you take things with a grain of salt. Be somewhat skeptical with what you get and look at. But it comes from a good source like Dan or some of these programs that have been out there for many years, then they're good resources. There are various exercise programs as well as focusing on diving that you can participate in. Main thing you're wanting to do is sort of increase your strength, both your extremities and your core, and get some of those activities going, get back to swimming and stretching. And if you haven't seen, or if you're not a member of Dan and don't get Alert Diver, they've had quite a few articles on dive fitness in their magazine. That all of those are online, you can look at. There's also a place called Scuba Fit that lists fitness suggestions for divers. And so the resources are there. You are not the same person you were at the beginning of this. You need to get yourself back into shape. You can't just jump in the water as if nothing has happened. You're going to have to work yourself up physically, mentally, and skill-wise. So the other thing we were going to look at is, are there issues if you've had COVID and now you want to go back into diving? And there's a wide response to COVID from people who basically were completely asymptomatic but had the virus, all the way up to the people who had to be intubated, put into ICU, and died. And now we're seeing something called long COVID. And this is for the more serious cases that there are chronic issues that may be there. This long COVID generally occurs in the older population and people with serious medical conditions, but it has occurred in young people as well. In fact, I have a friend who is dealing with this at this time. There are issues with the way the virus attacks the body, and it may cause heart, lung, and brain damage, and may cause clotting in the blood vessels. It may cause mood changes and fatigue, and also something called chronic fatigue syndrome, which is just this major lethargy where there's nobody, the person cannot get energy, and when they do activities, they tire very, very quickly. And I had a friend of mine years ago who had this, and it took him years to recover from it. So this can be very serious. And if you have issues like this and long COVID, then you really need to seriously consider whether you should be going back to diving. And this is something that you and your physician need to determine what's best for you. Last year, we talked about the Undersea Hyperbaric Medical Society response to what people should do once they recover from COVID, because there are some horror stories early on. And there's at one point people saying, if you've got COVID, you're not going to be able to dive again. Well, UHMS said that with study and research that throughout the year, there's going to be some thoughtful approach to making fitness to dive determinations. And that no matter what, like I said earlier, you need to work with your physician to work out your fitness to dive. But in terms of approaches, one of the things that's come out as a guide for assessment and getting people back into diving. And this is from the people down at UC San Diego, Hyperbaric Chamber, and people from the Albert Einstein College of Medicine in New York. And they have four categories of COVID. One is no history. Category one is suspected having it, but didn't seek help, didn't require oxygen, and your chest x-rays are normal. Category two is where they're suspected, where they required oxygen or were hypoxic, had abnormal chest x-rays, either that or CAT scan. They were admitted to a hospital but did not require intubation. And so these are the categories. And then the most severe is required intubation or ICU level of care, had some cardiac involvement, generally indicated by what's called troponins or cardiac biomarkers to indicate damage to the heart. And so these are the four categories that they're looking at. And so the recommendation is, if you had no history, just general initial periodic exam, and only getting chest x-rays if the professional group or the Recreational Scuba Training Council guidelines recommend you get it. And then it goes up to category one, where you're suspected of having it. You should at very least get spirometry to see how well your lungs are functioning, and a chest x-ray. And if it's unknown whether you had it or not, then exercise tolerance and testing with oxygen saturation, see if there's any damage to the lungs. And then when we get to the more serious cases, we're seeing a lot more studies in order to determine what your condition is and whether that condition will allow you to return to diving without a significant increase in risk. Primarily risk dealing with air embolism and any other things that may be involved in your lungs. So these are some of the recommendations that have come out. And so there are recommendations out there for what to do if you've had COVID and want to get cleared again for diving, or at least be evaluated to see if that is an option. If you've had COVID and are recovering and are a diver, then Dan wants to hear from you. They're doing a 5-year follow-up study looking at people who've had COVID who are returning to diving. And there's a location on their website that's listed on the screen where you can go and sign up to be part of this survey. So what they're trying to do is track a cohort of divers over 5 years to see if there's any impact that COVID would have had on their condition or their risks. And then finally, just please get vaccinated. If you have not gotten vaccinated, please do so. I know some people are hesitant, but the vaccines are safe and effective. Everybody 16 years and older now are eligible to get the vaccinations. Why do you get vaccinations? Number one, it'll keep you safe. It'll reduce the risk of you getting COVID. And there have been some cases where you may get COVID, but at least it doesn't progress to be serious COVID. Also, to keep others safe. So if you are vaccinated, then if you're around others who are susceptible and they haven't been vaccinated, then your risk of transmitting from you to them is much lower. And people always throw out, well, it's not safe, it's not safe. Well, it is safe. They have done controlled studies. And this is the latest information off the CDC webpage, is that in terms of adverse reactions to the vaccines, there was anaphylaxis in 2 to 5 people out of 1 million. And the blood clot issues that came up a month or so ago with the Johnson & Johnson, 23 cases in over 8.4 million. And that's 2 to 3 per million. And just to sort of put this in perspective, since we're all divers and we go out and increase our risk because of diving in the environment, we look at one of the studies Dan did years ago looking at the estimated occurrence of decompression sickness and air embolism in the diving community. And they came up with about 3.38 cases per 10,000 dives. This works out to be a rate of about 338 cases per million dives. So if you look at it, diving has approximately a 70 times greater risk than getting vaccinated for COVID. So again, I'd like to put it out there. If you haven't gotten vaccinated, we encourage you to do so. And basically, that's what I wanted to talk about tonight. And just remember, take things easy. You're getting back into diving. Take it slow, evaluate your skills, go in, do some simple dives, practice your skills, work with your buddy, make sure you're still working together fine, and work yourself back into it. Don't try to do that, 150-foot blue water dive just right out of the gate. You want to go and take things easy. So with that, I will turn things back over to Ken.